Introduction to Diabetes Management. Diabetes mellitus is a chronic metabolic disorder characterized by elevated blood glucose levels, resulting from either insufficient insulin production, insulin resistance, or both. This condition affects millions worldwide, posing a significant global health challenge with increasing prevalence across all age groups. Effective diabetes management is crucial for preventing severe complications and improving the quality of life for affected individuals. It involves a multifaceted approach that integrates medical, lifestyle, and educational interventions tailored to each patient's needs. Understanding the fundamentals of diabetes is the first step towards successful long-term care and patient empowerment. This course will equip healthcare professionals with the knowledge and skills necessary to provide comprehensive diabetes care. It emphasizes a holistic perspective on managing this complex disease. The impact of diabetes extends beyond individual health, affecting healthcare systems and economies globally due to the costs associated with treatment and managing complications. Early diagnosis and proactive management are key to mitigating these burdens and improving public health outcomes. This diploma aims to provide a robust foundation in current best practices for diabetes care, ensuring practitioners can deliver evidence-based interventions. It covers a spectrum of topics from basic physiology to advanced therapeutic strategies. Participants will gain practical insights into patient education and the application of modern technologies in diabetes management. Ultimately, the goal is to foster a generation of healthcare providers capable of making a tangible difference in the lives of people with diabetes. Understanding diabetes, types and causes. Diabetes mellitus is broadly categorized into several types, each with distinct underlying causes and pathophysiological mechanisms. Type 1 diabetes, often diagnosed in children and young adults, is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. This results in an absolute deficiency of insulin, necessitating lifelong insulin therapy. Genetic predisposition plays a significant role in type 1 diabetes, although environmental triggers are also believed to contribute to its onset. The destruction of beta cells is usually progressive, leading to symptoms appearing when a substantial portion of these cells are no longer functional. Understanding this autoimmune process is critical for diagnosis and management. Type 2 diabetes, the most common form, accounts for the vast majority of cases and typically develops in adults, though it is increasingly seen in younger populations. It is characterized by insulin resistance, where the body's cells do not respond effectively to insulin, combined with a relative deficiency in insulin production from the pancreas. Lifestyle factors such as obesity, physical inactivity, and unhealthy dietary habits are strong contributors to type 2 diabetes, alongside a significant genetic component. Gestational diabetes, another important type, occurs during pregnancy in women who have not previously had diabetes. It poses risks to both the mother and the developing fetus, often resolving after childbirth, but increasing the mother's risk of developing type 2 diabetes later in life. Other specific types of diabetes exist, but are less common, often linked to genetic defects, diseases of the pancreas, or certain medications. Physiology of glucose metabolism. Glucose metabolism is a fundamental biological process that ensures the body's cells receive the energy they need to function. When we consume food, carbohydrates are broken down into glucose, which is then absorbed into the bloodstream. This rise in blood glucose signals the pancreas to release insulin, a hormone crucial for regulating blood sugar levels. Insulin acts as a key, unlocking cells to allow glucose to enter and be used for energy or stored for later use. It facilitates glucose uptake by muscle and fat cells, and also promotes the conversion of glucose into glycogen in the liver and muscles for storage. Without sufficient insulin or proper insulin action, glucose accumulates in the blood, leading to hyperglycemia. Conversely, when blood glucose levels drop, the pancreas releases another hormone called glucagon. Glucagon's primary role is to raise blood glucose by signaling the liver to break down stored glycogen back into glucose and release it into the bloodstream. This intricate interplay between insulin and glucagon maintains glucose homeostasis, ensuring a stable supply of energy while preventing dangerously high or low blood sugar levels. The liver plays a central role in both storing and producing glucose, acting as a major regulator in this complex metabolic pathway. Understanding this delicate balance is essential for comprehending the mechanisms underlying diabetes and its management. Diagnosing diabetes. Criteria and tests. Accurate and timely diagnosis of diabetes is critical for initiating appropriate management and preventing long-term complications. Several standardized diagnostic tests are used to identify diabetes, each measuring different aspects of glucose metabolism. The most common tests include the fasting plasma glucose (FPG) test, the oral glucose tolerance test (OGTT), and the hemoglobin A1C (HbA1c) test. The FPG measures blood glucose after an overnight fast, providing a snapshot of the body's ability to regulate glucose without recent food intake. An FPG level of 126 mg per deciliter, 7.0 millimoles per liter, or higher on 2 separate occasions typically indicates diabetes. These tests are often performed in a clinical laboratory setting, requiring specific patient preparation to ensure accuracy. The OGTT involves measuring blood glucose levels before and 2 hours after consuming a standardized glucose drink, assessing how the body processes a large glucose load. A 2-hour plasma glucose level of 200 mg deciliter, 11.1 millimoles per liter, or higher during an OGTT confirms a diabetes diagnosis. The HbA1c test provides an average blood glucose level over the past 2 to 3 months by measuring the percentage of hemoglobin in red blood cells that is glycated. An HbA1c level of 6.5% or higher is diagnostic of diabetes. This test is particularly useful as it does not require fasting and reflects long-term glucose control. Random plasma glucose (RPG) of 200 mg deciliter, 11.1 millimoles per liter, or higher, with classic symptoms of hyperglycemia, also indicates diabetes. Early detection through these tests allows for prompt intervention and personalized treatment plans. Type 1 diabetes, pathophysiology and treatment. Type 1 diabetes is an autoimmune disease characterized by the immune system's destruction of insulin-producing beta cells in the pancreatic islets. This cellular attack leads to an absolute deficiency of insulin, meaning the body can no longer produce this vital hormone. The exact triggers for this autoimmune response are not fully understood, but a combination of genetic susceptibility and environmental factors is believed to play a role. Without insulin, glucose cannot enter cells for energy, leading to high blood sugar levels and the breakdown of fats for fuel, which can result in the production of ketones. This condition typically manifests in childhood or adolescence, but can occur at any age, requiring immediate and continuous medical attention. The progressive loss of beta cell function is a hallmark of the disease. The cornerstone of type 1 diabetes treatment is lifelong insulin replacement therapy. This involves administering exogenous insulin multiple times a day, either through injections with pens or syringes, or continuously via an insulin pump. The goal is to mimic the body's natural insulin secretion patterns as closely as possible, maintaining blood glucose levels within a target range. Patients must learn to balance insulin doses with carbohydrate intake, physical activity, and other factors affecting blood sugar. Regular blood glucose monitoring, often with continuous glucose monitors (CGMs), is essential for making informed treatment decisions. Education on carbohydrate counting, insulin action, and hypoglycemia management is vital for individuals with type 1 diabetes to effectively self-manage their condition and prevent acute complications. Type 2 diabetes, pathophysiology and treatment. Type 2 diabetes is primarily characterized by insulin resistance, a condition where the body's cells, particularly those in muscle, fat, and liver, do not respond effectively to insulin. Initially, the pancreas compensates by producing more insulin to overcome this resistance, maintaining normal blood glucose levels. However, over time, the beta cells in the pancreas may become exhausted and lose their ability to produce sufficient insulin, leading to a relative insulin deficiency. This combination of insulin resistance and impaired insulin secretion results in chronic hyperglycemia. Genetic predisposition, obesity, physical inactivity, and an unhealthy diet are major risk factors contributing to the development of type 2 diabetes. The progression of the disease is often slow and insidious, with symptoms developing gradually. Treatment for type 2 diabetes typically begins with lifestyle modifications, including dietary changes, increased physical activity, and weight loss. These interventions can significantly improve insulin sensitivity and glucose control, sometimes even leading to remission in early stages. When lifestyle changes are insufficient, pharmacological agents are introduced. Oral medications such as metformin, sulfonylureas, and SGLT2 inhibitors work through various mechanisms to lower blood glucose. In some cases, injectable medications like GLP-1 receptor agonists or eventually insulin therapy may be required as the disease progresses and beta cell function declines further. The treatment approach is highly individualized, focusing on achieving target blood glucose levels while minimizing side effects and preventing complications. Regular monitoring of blood glucose and HbA1c is essential to assess treatment effectiveness. Gestational diabetes, risks and management. Gestational diabetes mellitus, GDM, is a form of glucose intolerance that is first diagnosed during pregnancy in women who did not have diabetes before conception. Hormonal changes during pregnancy can lead to insulin resistance, particularly in the second and third trimesters. While the pancreas usually produces extra insulin to compensate, in some women, it cannot produce enough, leading to elevated blood glucose levels. Risk factors for GDM include a family history of diabetes, obesity, advanced maternal age, and certain ethnic backgrounds. If left unmanaged, GDM can pose significant health risks to both the mother and the developing fetus. It is crucial to identify and manage this condition promptly to ensure a healthy pregnancy outcome. Management of gestational diabetes typically begins with intensive lifestyle modifications, focusing on dietary changes and regular physical activity. A registered dietitian often provides guidance on meal planning, emphasizing balanced nutrition and appropriate carbohydrate intake to help stabilize blood glucose levels. Moderate exercise, such as brisk walking, is usually recommended and safe during pregnancy, contributing to improved insulin sensitivity. If lifestyle interventions are insufficient to achieve target blood glucose levels, medication may be necessary. Insulin is often the preferred pharmacological treatment for GDM, due as it does not cross the placenta. Oral medications like metformin may also be considered in certain cases. Close monitoring of blood glucose levels is paramount throughout the pregnancy, and women with GDM require careful follow-up after delivery due to an increased risk of developing type 2 diabetes later in life. Prediabetes, identification and prevention. Prediabetes is a critical health condition where blood glucose levels are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. It is often referred to as impaired glucose tolerance, IGT, or impaired fasting glucose, IFG, depending on the specific test results. Individuals with prediabetes typically have an HbA1c between 5.7% and 6.4%, a fasting plasma glucose between 100 and 125 milligrams per deciliter, or a 2-hour plasma glucose during an OGTT between 140 and 199 milligrams per deciliter. Prediabetes is a strong indicator of increased risk for developing type 2 diabetes, heart disease, and stroke. Recognizing and addressing prediabetes is a crucial opportunity for intervention to prevent or delay the onset of full-blown diabetes. Many people with prediabetes are unaware they have the condition, highlighting the importance of screening. The primary goal of managing prediabetes is to prevent its progression to type 2 diabetes through intensive lifestyle interventions. These interventions include significant dietary changes, such as reducing intake of refined sugars and unhealthy fats, and increasing consumption of whole grains, fruits, and vegetables. Regular physical activity, aiming for at least 150 minutes of moderate intensity exercise per week, is also highly effective in improving insulin sensitivity and promoting weight loss. Even a modest weight loss of 5 to 7% of body weight can significantly reduce the risk of developing type 2 diabetes. In some cases, medication like metformin may be considered, especially for individuals at very high risk, but lifestyle modification remains the cornerstone of prevention. Regular monitoring and follow-up are essential to track progress and reinforce healthy habits. Pharmacological management, oral medications. Oral medications play a crucial role in the management of type 2 diabetes, often serving as the first-line treatment when lifestyle modifications alone are insufficient. These medications work through various mechanisms to lower blood glucose levels. Metformin, a biguanide, is typically the initial drug of choice. It primarily reduces glucose production by the liver and improves insulin sensitivity in peripheral tissues. Sulfonylureas stimulate the pancreas to produce more insulin, while meglitinides also increase insulin secretion but have a faster onset and shorter duration of action. Thiazolidinediones, TZDs, enhance insulin sensitivity in muscle and fat cells. Each class of medication has specific indications, contraindications, and potential side effects that must be carefully considered by healthcare providers. Newer classes of oral medications offer additional options for glucose control and cardiovascular renal benefits. Dipeptidyl peptidase 4, DPP4 inhibitors increase insulin release and decrease glucagon secretion by preventing the breakdown of incretin hormones. Sodium glucose cotransporter 2, SGLT2 inhibitors work by blocking glucose reabsorption in the kidneys, leading to increased glucose excretion in the urine. Alpha-glucosidase inhibitors slow down carbohydrate digestion and absorption in the gut, reducing post-meal glucose spikes. Glucagon-like peptide 1 receptor agonists, GLP-1RAs, are also available in oral forms, mimicking natural incretin hormones to enhance insulin secretion, suppress glucagon, and slow gastric emptying. The choice of medication depends on individual patient characteristics, comorbidities, and treatment goals, often involving a combination of agents for optimal glycemic control. Insulin therapy, types and administration. Insulin therapy is a cornerstone of diabetes management, particularly for individuals with type 1 diabetes who have an absolute insulin deficiency, and for many with type 2 diabetes whose beta cells can no longer produce sufficient insulin. Various types of insulin are available, categorized by their onset, peak, and duration of action, allowing for flexible dosing regimens. Rapid-acting insulins, example insulin lispro, aspart, glulicine, work quickly and are typically taken before meals to cover carbohydrate intake. Short-acting insulins, regular insulin, have a slightly slower onset and longer duration. Intermediate-acting insulins, NPH, provide basal coverage for about half a day, while long-acting insulins, example insulin glargine, detamir, degludec, offer prolonged basal coverage, often for 24 hours or more, mimicking the body's continuous insulin needs. Premixed insulins combine different types for convenience. Insulin is administered primarily through subcutaneous injection, most commonly using insulin pens or syringes. Insulin pens are pre-filled devices that are easy to use and discreet, making them popular for daily injections. Syringes, while requiring drawing insulin from vials, offer precise dosing flexibility. Insulin pumps provide continuous subcutaneous insulin infusion, delivering small, steady doses of rapid-acting insulin throughout the day and boluses at mealtimes, offering greater flexibility and tighter glucose control. Proper injection technique, including rotating injection sites to prevent lipohypertrophy, is crucial for effective absorption and patient comfort. Patients must be thoroughly educated on insulin storage, dose adjustment, and recognizing and managing potential side effects like hypoglycemia. Advanced systems, like closed-loop artificial pancreas devices, are also emerging, further automating insulin delivery based on continuous glucose monitoring. Monitoring blood glucose. Devices and techniques. Effective diabetes management relies heavily on consistent and accurate monitoring of blood glucose levels, providing vital information for making informed treatment decisions. Self-monitoring blood glucose, SMBG, using a glucometer is a traditional and widely used method. This involves pricking a fingertip to obtain a small blood sample, which is then applied to a test strip inserted into the glucometer. The device provides a blood glucose reading within seconds. SMBG helps individuals understand how food, exercise, stress, and medication affect their blood sugar, allowing for immediate adjustments to their management plan. The frequency of SMBG varies depending on the type of diabetes, treatment regimen, and individual needs, but it is particularly crucial for those on insulin therapy. Continuous glucose monitoring, CGM, systems represent a significant advancement in diabetes care, offering a more comprehensive picture of glucose trends throughout the day and night. A small sensor, typically inserted under the skin on the arm or abdomen, measures interstitial glucose levels every few minutes. This data is then wirelessly transmitted to a receiver or smartphone app, providing real-time readings, glucose trends, and alerts for high or low blood sugar. CGM can reveal patterns that might be missed with intermittent SMBG, such as nocturnal hypoglycemia or post-meal spikes. It empowers patients and healthcare providers to make more proactive and precise adjustments to insulin doses, diet, and activity. Flash glucose monitoring, FGM, is a similar technology that requires scanning the sensor with a reader or smartphone to get a reading, offering convenience without real-time alerts. Both CGM and FGM enhance understanding of glycemic control and support personalized management strategies. Nutritional management. Dietary principles. Nutritional management is a cornerstone of diabetes care, playing a pivotal role in achieving and maintaining optimal blood glucose control, managing weight, and preventing complications. The fundamental principle involves adopting a balanced eating pattern that focuses on whole, unprocessed foods. This includes a rich intake of non-starchy vegetables, lean proteins, and healthy fats, while carefully managing carbohydrate intake. It is not about eliminating carbohydrates entirely, but rather choosing complex carbohydrates with a low glycemic index, such as whole grains, legumes, and certain fruits, which cause a slower and more gradual rise in blood sugar. Portion control is also critical to prevent overeating and manage calorie intake effectively. Understanding the impact of different food groups on blood glucose is essential for individuals with diabetes. Limiting the consumption of refined sugars, sugary beverages, and highly processed foods is paramount, as these can cause rapid spikes in blood glucose. Instead, individuals are encouraged to opt for water, unsweetened tea, or coffee. The timing and consistency of meals can also influence blood glucose stability. Eating regular meals and snacks can help prevent large fluctuations. Fiber-rich foods are beneficial as they slow down glucose absorption and contribute to satiety. While specific dietary recommendations may vary based on individual needs, cultural preferences, and comorbidities, the overarching goal is to promote a sustainable, healthy eating pattern that supports glycemic control and overall well-being. Consulting with a registered dietitian is highly recommended to develop a personalized meal plan. Carbohydrate counting, practical application. Carbohydrate counting is an advanced nutritional strategy that empowers individuals with diabetes, particularly those on insulin therapy, to precisely manage their blood glucose levels. This method involves tracking the amount of carbohydrates consumed at each meal and snack, and then adjusting insulin doses accordingly. The premise is that carbohydrates have the most significant and immediate impact on blood glucose levels compared to proteins and fats. Learning to identify carbohydrate-containing foods and estimate their portions accurately is a fundamental skill. This requires understanding food labels, using measuring cups, and recognizing serving sizes for various food items. Accurate carbohydrate counting allows for greater flexibility in meal planning and can lead to improved glycemic control. To effectively implement carbohydrate counting, individuals typically work with a registered dietitian or diabetes educator to determine their individual carbohydrate goals and insulin to carbohydrate ratios. For example, a person might learn that 1 unit of rapid-acting insulin covers a specific number of grams of carbohydrates. They also learn to factor in correction doses for elevated blood glucose levels. This personalized approach helps to prevent post-meal hyperglycemia and reduce the risk of hypoglycemia. Practical application involves consistently reading food labels, estimating portion sizes, and recording carbohydrate intake. Regular practice and ongoing education are essential for mastering carbohydrate counting and integrating it seamlessly into daily diabetes management, leading to more stable blood glucose levels and enhanced dietary freedom. Physical activity, benefits and guidelines. Regular physical activity is a powerful tool in diabetes management, offering numerous benefits for glycemic control, cardiovascular health, and overall well-being. Exercise helps improve insulin sensitivity, meaning the body's cells become more responsive to insulin, allowing glucose to enter more efficiently. This directly contributes to lower blood glucose levels. Physical activity also aids in weight management, reduces blood pressure, lowers harmful cholesterol levels, and strengthens the heart and blood vessels. For individuals with type 2 diabetes, consistent exercise can significantly reduce the risk of complications and may even help achieve remission in some cases. It also provides mental health benefits, reducing stress and improving mood, which are crucial for managing a chronic condition. Incorporating physical activity into daily routines is a vital component of a comprehensive diabetes care plan. General guidelines recommend at least 150 minutes of moderate-intensity aerobic activity per week, spread over at least 3 days, with no more than 2 consecutive days without exercise. Examples include brisk walking, swimming, cycling, or dancing. Additionally, strength training exercises for all major muscle groups are recommended 2 to 3 times per week. Before starting any new exercise program, individuals with diabetes should consult their healthcare provider to ensure it is safe and appropriate, especially if they have pre-existing complications. Special considerations include monitoring blood glucose before, during, and after exercise to prevent hypoglycemia or hyperglycemia, staying hydrated, and wearing appropriate footwear to protect the feet. Adjustments to medication or food intake may be necessary based on activity levels. Consistent adherence to these guidelines can lead to substantial improvements in diabetes control and quality of life. Weight management. Strategies for diabetes. Weight management is a critical component of diabetes care, particularly for individuals with type 2 diabetes, where obesity and excess body fat are major contributing factors to insulin resistance. Even a modest weight loss of 5 to 10% of initial body weight can significantly improve glycemic control, reduce the need for medication, and lower the risk of cardiovascular complications. Strategies for weight management typically involve a combination of reduced calorie intake and increased physical activity. Creating a sustainable calorie deficit through dietary changes such as portion control, choosing nutrient-dense foods, and limiting processed items is fundamental. Behavioral changes, including mindful eating and addressing emotional eating, also play a crucial role in long-term success. Weight loss can lead to improved insulin sensitivity and often results in better blood pressure and lipid profiles. For some individuals, especially those with significant obesity, BMI, greater than 35 to 40 kilograms per squared, and poorly controlled diabetes, bariatric surgery may be a highly effective option for weight loss and diabetes remission. Procedures like gastric bypass or sleeve gastrectomy can lead to dramatic and sustained weight reduction, often resulting in rapid improvements in blood glucose levels, sometimes even before substantial weight loss occurs. However, bariatric surgery is a major intervention with potential risks and requires careful patient selection and comprehensive postoperative care. Pharmacological agents for weight loss may also be considered as an adjunct to lifestyle interventions for individuals who struggle to achieve their weight goals. Regardless of the chosen strategy, ongoing support, education, and regular monitoring are essential for successful and sustainable weight management in the context of diabetes. A multidisciplinary team approach, including dietitians, exercise physiologists, and bariatric specialists, is often beneficial. Acute complications, hypoglycemia and hyperglycemia. Acute complications of diabetes, primarily hypoglycemia and hyperglycemia, require immediate recognition and management to prevent serious health consequences. Hypoglycemia, or low blood sugar, occurs when blood glucose levels drop below a healthy range, typically below 70 mg per deciliter, 3.9 millimoles per liter. It can be caused by too much insulin or diabetes medication, insufficient food intake, increased physical activity, or alcohol consumption. Symptoms can include shakiness, sweating, dizziness, confusion, irritability, hunger, and a rapid heartbeat. Severe hypoglycemia can lead to seizures, unconsciousness, and even death if not treated promptly. Recognizing these symptoms and acting quickly is crucial for patient safety. Patients on insulin or certain oral medications are at higher risk. Hyperglycemia, or high blood sugar, occurs when blood glucose levels are too high, typically above 180 mg per deciliter, 10.0 millimoles per liter for prolonged periods. It can result from insufficient insulin, illness, stress, certain medications, or excessive carbohydrate intake. Common symptoms include increased thirst, frequent urination, fatigue, blurred vision, and headache. Persistent hyperglycemia can lead to more severe acute complications like diabetic ketoacidosis, DKA. In type 1 diabetes or hyperosmolar hypoglycemic state, HHS, in type 2 diabetes, while not immediately life-threatening like severe hypoglycemia, prolonged hypoglycemia contributes to the development of chronic diabetes complications over time. Both hyperglycemia and hypoglycemia require careful monitoring and appropriate interventions to restore blood glucose to a safe range. Diabetic ketoacidosis, DKA, and HHS, diabetic ketoacidosis, DKA, and hyperosmolar hypoglycemic state, HHS, are severe, life-threatening acute complications of diabetes that require immediate medical attention. DKA primarily affects individuals with type 1 diabetes, but can occur in type 2 under severe stress or illness. It develops when there is an absolute or severe lack of insulin, leading the body to break down fat for energy, producing acidic byproducts called ketones. This results in metabolic acidosis, high blood glucose, and dehydration. Symptoms include extreme thirst, frequent urination, nausea, vomiting, abdominal pain, deep and rapid breathing, small respirations, and a fruity breath odor. DKA is a medical emergency that can lead to coma and death if not treated promptly with insulin, fluids, and electrolyte replacement. Hyperosmolar hypoglycemic state, HHS, formerly known as HHNS, is a serious complication more common in type 2 diabetes, often triggered by severe illness or infection. It is characterized by extremely high blood glucose levels, often greater than 600 mg per deciliter, severe dehydration, and hyperosmolarity, but without significant ketosis or acidosis. The body still produces some insulin, enough to prevent ketone formation, but not enough to prevent severe hyperglycemia and dehydration. Symptoms include profound thirst, frequent urination, confusion, drowsiness, and neurological deficits. HHS develops more slowly than DKA, but is equally life-threatening. Treatment involves aggressive fluid replacement, insulin therapy, and electrolyte management. Both DKA and HHS underscore the critical importance of consistent diabetes management, sick day rules, and prompt medical evaluation for severe symptoms. Chronic complications, microvascular chronic hypoglycemia, characteristic of poorly controlled diabetes over many years, leads to damage of small blood vessels, resulting in microvascular complications. These complications include diabetic retinopathy, nephropathy, and neuropathy, which can significantly impair quality of life and lead to severe disability. Diabetic retinopathy affects the eyes, damaging the blood vessels in the retina and potentially leading to vision loss and blindness. Regular dilated eye exams are crucial for early detection and treatment, which may include laser therapy or injections. Maintaining strict blood glucose control, blood pressure, and lipid levels is paramount in preventing or slowing the progression of retinopathy, emphasizing the importance of comprehensive management. Diabetic nephropathy is kidney disease caused by diabetes, where high blood sugar damages the small blood vessels in the kidneys, impairing their ability to filter waste products from the blood. It can progress to end-stage renal disease, requiring dialysis or kidney transplantation. Regular screening for microalbuminuria, small amounts of protein in the urine, and monitoring kidney function are essential for early diagnosis. Blood pressure control, often with ACE inhibitors or ARBs, and strict glycemic management are key preventive measures. Diabetic neuropathy refers to nerve damage caused by high blood sugar, affecting various parts of the body. Peripheral neuropathy, affecting the feet and hands, can cause numbness, tingling, pain, and loss of sensation, increasing the risk of foot ulcers and amputations. Autonomic neuropathy can affect the digestive system, heart, and bladder. Comprehensive diabetes management is vital for mitigating these debilitating microvascular complications. Chronic complications, macrovascular. Beyond microvascular damage, chronic hyperglycemia and other diabetes-related factors significantly increase the risk of macrovascular complications, affecting the large blood vessels. These include cardiovascular disease, CVD, such as heart attack and stroke, and peripheral artery disease, PAD. Diabetes accelerates atherosclerosis, the hardening and narrowing of arteries, leading to reduced blood flow to vital organs and extremities. Individuals with diabetes often have a higher prevalence of traditional cardiovascular risk factors like high blood pressure, dyslipidemia, abnormal cholesterol levels, and obesity, all of which are exacerbated by poor glycemic control. These complications are a leading cause of morbidity and mortality among people with diabetes, underscoring the importance of comprehensive risk factor management. Preventing and managing macrovascular complications requires a multi-pronged approach that extends beyond just blood glucose control. Aggressive management of blood pressure, typically targeting levels below 130 to 80 mm mercury, is crucial. Lipid management, often involving statin therapy to lower LDL cholesterol, is also essential. Antiplatelet therapy, such as low-dose aspirin, may be considered for individuals at high cardiovascular risk. Lifestyle modifications, including a heart-healthy diet, regular physical activity, and smoking cessation, are fundamental. Regular screening for cardiovascular risk factors and early detection of symptoms are vital. A holistic approach that addresses all modifiable risk factors, glycemic control, blood pressure, lipids, weight, and lifestyle, is necessary to reduce the burden of macrovascular disease in individuals with diabetes and improve long-term outcomes. Diabetic foot care, prevention and management. Diabetic foot complications are a serious and common issue, often leading to infections, ulcers, and in severe cases, amputation. These complications arise primarily due to diabetic neuropathy, which causes loss of sensation in the feet, and peripheral artery disease, PAD, which reduces blood flow. Neuropathy means individuals may not feel pain from injuries, blisters, or pressure points, allowing them to worsen unnoticed. PAD impairs wound healing and increases susceptibility to infection. Regular and meticulous foot care is therefore paramount for individuals with diabetes to prevent these devastating outcomes. Education on proper foot hygiene and inspection is a critical component of diabetes self-management, empowering patients to take proactive steps in their care. Key preventive measures include daily inspection of the feet for cuts, blisters, redness, swelling, or any changes. Patients should wash their feet daily with lukewarm water, dry them thoroughly, especially between the toes, and moisturize to prevent dry skin and cracking. Proper footwear is essential. well-fitting, comfortable shoes that provide adequate support and protection, avoiding tight or ill-fitting shoes that can cause pressure points. Toenails should be trimmed carefully, preferably by a podiatrist. Any foot injury, no matter how minor, should be reported to a healthcare provider immediately. Regular foot examinations by a healthcare professional, including assessment of sensation, circulation, and skin integrity, are crucial for early detection of problems. Prompt and aggressive management of foot ulcers, including wound care, infection control, and offloading pressure, is vital to prevent progression and avoid amputation. A multidisciplinary approach involving podiatrists, endocrinologists, and wound care specialists is often required. Psychological aspects of diabetes. Living with a chronic condition like diabetes can significantly impact an individual's mental and emotional well-being. The constant demands of self-management, including blood glucose monitoring, medication adherence, dietary restrictions, and regular exercise, can lead to stress, anxiety, and even depression. Many individuals experience diabetes distress, a term that describes the emotional burden of living with and managing diabetes, which can manifest as feelings of frustration, guilt, fear, and being overwhelmed. This distress is distinct from clinical depression, but can negatively affect self-care behaviors and glycemic control. Recognizing and addressing these psychological aspects is crucial for holistic diabetes management, as mental health directly influences physical health outcomes. Healthcare providers must be sensitive to these challenges and integrate mental health support into routine care. Coping strategies and psychological support are vital for individuals navigating the emotional complexities of diabetes. This can include counseling, cognitive behavioral therapy, CBT, stress management techniques, and participation in support groups. Support groups provide a safe space for individuals to share experiences, gain peer support, and learn coping mechanisms from others facing similar challenges. Healthcare teams should routinely screen for signs of depression, anxiety, and diabetes distress, and refer patients to mental health professionals when appropriate. Empowering patients with coping skills, fostering a positive outlook, and ensuring access to psychological resources can significantly improve their overall quality of life, adherence to treatment, and glycemic control. Addressing the psychological burden is as important as managing the physical symptoms of diabetes. Diabetes education, empowering patients. Diabetes education is a cornerstone of effective diabetes management, empowering individuals to take an active role in their own care and make informed decisions. It involves providing comprehensive knowledge about diabetes, including its pathophysiology, treatment options, self-monitoring techniques, and complication prevention. Education goes beyond simply imparting facts. It focuses on developing practical skills, fostering self-efficacy, and promoting behavioral changes necessary for long-term health. A well-educated patient is better equipped to manage their condition, adhere to treatment plans, and recognize and respond to changes in their health. This proactive approach significantly improves glycemic control, reduces the risk of acute and chronic complications, and enhances overall quality of life. Effective education is tailored to individual learning styles, cultural backgrounds, and health literacy levels. Key components of diabetes education include instruction on carbohydrate counting and meal planning, understanding the different types of medications and their administration, proper blood glucose monitoring, and strategies for physical activity. It also covers sick day management, foot care, and recognizing and treating hypoglycemia and hyperglycemia. Beyond practical skills, education addresses goal setting, problem solving, and coping with the psychological challenges of living with diabetes. Diabetes educators, often registered nurses or dietitians with specialized training, play a vital role in delivering structured education programs. These programs foster shared decision-making between patients and their healthcare team, creating a collaborative environment that supports sustained self-management. Continuous education and reinforcement are essential as diabetes management evolves and individual needs change over time. Technology and diabetes management. Advancements in technology have revolutionized diabetes management, offering individuals more precise tools for monitoring glucose, delivering insulin, and making informed decisions. Continuous glucose monitoring (CGM) systems, as discussed earlier, provide real-time glucose data, trends, and alerts, significantly reducing the burden of finger prick tests and improving glycemic control. Smart insulin pens, which connect to smartphone apps, record insulin doses and timings, helping individuals track their medication adherence and calculate appropriate doses. These devices integrate seamlessly into daily life, providing valuable insights that empower users to manage their condition more effectively. The data collected by these technologies can also be shared with healthcare providers, facilitating more personalized and timely adjustments to treatment plans. Further innovations include advanced insulin pumps and closed-loop systems, often referred to as an artificial pancreas. These systems integrate CGM data with an insulin pump, automatically adjusting insulin delivery based on real-time glucose readings, minimizing the need for manual intervention. Mobile applications and telehealth platforms also play a crucial role, offering educational resources, meal tracking, exercise logs, and virtual consultations with healthcare professionals. These technologies enhance convenience, improve adherence, and provide a greater sense of control for individuals living with diabetes. The ongoing development of even more sophisticated devices and integrated platforms promises to further simplify and optimize diabetes management, moving towards a future of highly personalized and automated care. Special populations, elderly and children. Managing diabetes in special populations, such as the elderly and children, presents unique challenges and requires tailored approaches. In older adults, diabetes management must consider comorbidities, cognitive function, functional status, and the risk of hypoglycemia. Treatment goals may be less stringent to prioritize safety and quality of life, focusing on preventing symptomatic hypoglycemia and severe hypoglycemia. Polypharmacy, frailty, and social support systems are also important considerations. Education for elderly patients often needs to be adapted to address potential visual or cognitive impairments, emphasizing simplicity and practical application. The goal is to optimize glycemic control without compromising overall health and independence, ensuring a balance between tight control and avoiding adverse events. Individualized care plans are paramount for this demographic. In children and adolescents, diabetes management focuses on promoting normal growth and development, preventing acute and chronic complications, and integrating diabetes care into family life and school routines. Type 1 diabetes is more prevalent in this age group, requiring intensive insulin therapy and careful attention to carbohydrate intake, physical activity, and growth spurts. Psychological support for both the child and family is crucial, as managing diabetes can be emotionally demanding. Education must be age-appropriate, involving parents, guardians, and school staff. The goal is to empower children to gradually take on more responsibility for their self-care as they mature, while ensuring they maintain a good quality of life and achieve their full potential. Type 2 diabetes is also increasingly seen in children, necessitating interventions for obesity and lifestyle changes. Team-based diabetes care. Effective diabetes management is rarely achieved by a single healthcare provider. It requires a collaborative, team-based approach involving a multidisciplinary group of professionals. This integrated care model ensures that all aspects of a patient's physical and psychological health are addressed comprehensively. The core team typically includes an endocrinologist or primary care physician who oversees the overall medical management, prescribing medications and coordinating care. A registered dietitian provides crucial guidance on nutritional management, meal planning, and carbohydrate counting, tailoring advice to individual needs and preferences. A diabetes educator, often a nurse or dietitian, empowers patients with knowledge and skills for self-management, fostering confidence and adherence to treatment plans. This collaborative effort ensures that patients receive holistic and personalized care, addressing their diverse needs. Beyond the core team, other specialists play vital roles in preventing and managing diabetes complications. A podiatrist is essential for regular foot examinations and managing foot complications, helping to prevent ulcers and amputations. An ophthalmologist conducts regular eye exams to screen for and treat diabetic retinopathy, preserving vision. A nephrologist may be involved in managing diabetic kidney disease. Mental health professionals, such as psychologists or counselors, provide support for diabetes distress, depression, and anxiety, which are common among individuals with chronic conditions. Pharmacists offer expertise on medication management, potential drug interactions, and adherence. This comprehensive team approach ensures that patients receive specialized care for all aspects of their diabetes, leading to better health outcomes, improved quality of life, and reduced risk of complications. Effective communication and coordination among team members are paramount for successful patient care. Future directions in diabetes research. The field of diabetes research is continuously evolving, with exciting advancements on the horizon that promise to transform prevention, treatment, and ultimately a cure. One major area of focus is stem cell research, aiming to regenerate or replace insulin-producing beta cells in the pancreas, particularly for type 1 diabetes. Scientists are exploring various stem cell sources and differentiation protocols to create functional islet cells that could be transplanted into patients, potentially restoring natural insulin production. Encapsulation technologies are also being developed to protect these transplanted cells from immune attack, reducing the need for immunosuppressive drugs. These innovative approaches hold immense potential for a long-term solution to insulin dependency. The goal is to restore the body's natural ability to regulate glucose. Another promising avenue is the development of advanced closed-loop systems, or artificial pancreas devices, which are becoming increasingly sophisticated, offering fully automated insulin delivery. Research is also delving into genetic interventions and personalized medicine, using an individual's genetic profile to predict diabetes risk, tailor prevention strategies, and optimize treatment choices. New pharmacological agents with novel mechanisms of action are continually being investigated, aiming for better glycemic control with fewer side effects and additional cardiovascular or renal benefits. Immunotherapy strategies are being explored to halt the autoimmune destruction of beta cells in type 1 diabetes. The future of diabetes management is moving towards highly individualized, preventative, and potentially curative therapies, driven by cutting-edge scientific and technological innovation. These advancements offer hope for a future where diabetes is no longer a life-limiting condition,